Concern for many is colon cancer. With March being Colorectal Cancer Awareness Month, Dr. Russell Gollard is here from our Nevada cancer specialist to talk about prevention. And Dr. Gollard, you are the medical director of Nevada Cancer Specialists, and this is Colorectal Cancer Awareness Month, and I was surprised in prepping for this interview to find out how many Americans are impacted by this.
Oh, yes. There are more than 90,000 new cases when you combine colon cancer and rectal cancer every year. As you mentioned, it is highly preventable. What we recommend is that people after the age of 50 have a colonoscopy, and then one repeated every 5 years. Usually this cancer starts in a polyp, and these polyps can be detected and removed during the colonoscopy procedure.
Yeah, as a matter of fact, early detection would prevent 60% of the cases, I understand, so more than half of the cases of cancer could be prevented with proper screening.
Absolutely. Yes.
And people are reticent, though, to do that screening because it's not comfortable, quite frankly.
Yeah, absolutely. I think the preps have gotten better over time, but still nobody looks forward to going and having a colonoscopy.
Yeah.
And it is uncomfortable, and it's something that we don't talk about in polite conversation sometimes, and it's something that sometimes people don't even mention to their physicians.
Right.
But the most important thing to consider is screening, as it is recommended by the American Cancer Society. That is, taking in those people, everybody between the ages of 50 and 75, and then earlier if there is a family history. Now, one interesting point, which is probably related to diet, is that we have a rash of colon cancers in younger people. The age at onset seems to be skewed lower and lower. So I think everybody needs to be educated about it and needs to watch out for those warning signs and then to get the appropriate screening when it is due.
And a colonoscopy obviously is the most thorough way to screen for this cancer, but there are other ways to detect it, correct?
Yeah, there are. There is, of course, fecal occult blood screening, where fecal matter is examined for the presence of blood, but that's not 100% sensitive. The assumption is that if you have colon cancer, you will bleed from that colon cancer, but that's not always the case. And sometimes, in fact, the bleeding is sporadic. Some people may not bleed at all or may bleed intermittently.
Well, what you are doing for the community is fantastic. It's always great to have specialists here, and you have 2 offices now and 1 opening next week, right?
Yes, we have another one opening next week. We're going to eventually have 4 offices in town. We have 4 medical oncologists, all of whom have been in the community for quite some time with us. We're soon to add 2 more. We also have a nurse practitioner. We're soon to add several more nurse practitioners, and we plan on expanding at a steady pace through the next year and a half, such that we can serve this great community.
Well, fantastic, and we're glad you're here, and we saw the 3 locations up on the screen earlier. If you didn't catch those, you can go to our website for a link to their website and find out which one's closest to you. And a special thanks to Southwest Medical Associates for being one Community Pride sponsor and partnering with us for this segment.